Have you ever noticed subtle changes in muscle strength, perhaps dismissing them as just part of getting older or being a bit out of shape? Sometimes, these seemingly minor changes can be clues pointing to something more specific. Yes, you can identify Becker muscular dystrophy symptoms, which often involve progressive muscle weakness that typically appears later in childhood or adolescence, progressing slower than other types of muscular dystrophy. These symptoms usually begin in the muscles of the legs and pelvis, making activities like running or climbing stairs more challenging. The core reason behind Becker muscular dystrophy is a genetic change, specifically a mutation in the DMD gene. This gene is responsible for providing the blueprint for dystrophin, a vital protein that acts like a shock absorber for your muscle fibers, protecting them from damage during movement. In Becker muscular dystrophy, unlike its more severe counterpart Duchenne muscular dystrophy, some dystrophin is still produced, but it is either reduced in quantity or its function is impaired. This partial but insufficient production allows muscles to function longer, resulting in a slower and milder progression of weakness. To recognize these signs, pay attention to difficulties with physical activities, such as struggling to keep up with peers on the playground or needing to use handrails more often. Other common indicators include muscle cramps, experiencing fatigue more easily than expected, and sometimes an enlargement of the calf muscles, which is known as pseudohypertrophy. If you or a loved one notice these persistent signs, the next step is to consult with a medical professional, such as a neurologist or a genetic specialist, to explore these observations further. It is interesting to note that while the progression is generally slower, the specific pattern and severity of symptoms can vary widely among individuals with Becker muscular dystrophy. For instance, some people might experience more pronounced heart involvement, known as cardiomyopathy, even before significant limb weakness becomes apparent. Definitive diagnosis often involves a combination of tests, including a physical examination, blood tests to check for elevated creatine kinase levels which indicate muscle damage, and most importantly, genetic testing which can confirm the specific DMD gene mutation. Early and accurate diagnosis is a powerful tool, as it opens the door to proactive management strategies. Understanding the unique genetic underpinnings and recognizing the range of potential symptoms of Becker muscular dystrophy empowers individuals and their families. This knowledge allows for timely intervention, such as tailored physical therapy, regular cardiac monitoring, and other supportive care measures. By acting on these observations, you can work with your healthcare team to develop a comprehensive plan, aiming to maintain muscle function and enhance overall quality of life for as long as possible.